Hello, my name is Chelsea Wilson, and my future career choice is to be an occupational therapist. I would like to work with geriatrics as well as stroke victims. So according to AOTA.org, an occupational therapist is someone who is helping a patient regain their independence by improving their functions of daily living and helping them feel more comfortable living on their own or with minimal assistance, as well as building a positive quality of life for that individual. So the first factor of nonverbal communication that would be helpful being an occupational therapist is my physical appearance. So I would like to come across very professional and conservative because I will be working with patients from the 50s, and they were raised to respect women, and women were raised to dress conservatively and not as racy as they do nowadays. So according to nonverbal communication in interpersonal relationships, our class book states what features we consider attractive are highly dependent on cultural and historical influences as well as current trends. So I would want to match their trends from the 50s or the same type of style, and I would not dress like I was working with people who were born in the late 90s to early 2000s because they are used to women dressing in tight, revealing clothing, and that is how they show that they are more attractive and usually get farther along in the workplace. But I want to look knowledgeable and trustful. Another important factor of physical appearance would be when I first meet a patient, I will judge their cleanliness and their hygiene, and that will be a part of their treatment plan, is getting them back to the normal hygiene level that they should be at, so they can be more respected in public or wanting to get out of the house because they finally feel clean. So it could be brushing their teeth or teaching them how to safely bathe by themselves. The next category of nonverbal communication I will be using in occupational therapy is gestures and movements. So as a therapist, I play a great deal of being an illustrator, demonstrating exercises and making sure everyone's doing the proper form by performing it myself first. When I'm working with patients, I will sit at a comfortable distance to them so that they can hear me and I can hear them, so there's no miscommunication between us. And some patients that come to me, I have a very difficult time speaking due to strokes or deafness, then it's helpful for me to be able to use my gestures and movements and to be able to understand theirs. The next category of nonverbal communication is facial behavior, and this is a big one because I'm working with different people all day long and everyone displays emotions just a little bit differently, so I have to be able to understand a whole range of them and to be able to control my own. So the first part would be if somebody's in pain in the clinic, it's kind of hard to tell at first until you really get to know that patient and how they feel doing an exercise or while you're doing manual treatment on them. So I think that's the most important thing to know about their facial behavior, is what pain looks like. And then the second part is if you have good news for the patient or they have good news for you or they met a very important goal, then you need to intensify your emotion. And I think it would be a type of conditioning for that patient that they know if they do well, then you're happy and it makes them happy, and they respond very well to happiness. And that's where I could be the most successful. So I mentioned that I want to work with mostly stroke victims, and so I found this infographic from Villar Pharmaceuticals, and it talks about the side effects of a stroke. And some of them that can be treated with therapy, I think, are aphasia and hemiparesis. So aphasia is when you have a very difficult time encoding and decoding speech. So I think if you supplement nonverbal communication with that treatment, then it can be very successful. Same with hemiparesis, that is when a patient has one-sided weakness of their body. So if I understand the muscles and innervations for the different gestures and movements as well as facial behaviors, then I can hopefully get that patient back to a normal, fluid, moving motion so that they can use emblems, they can display a full face of affection for a loved one, or if they're sad, or if they're really happy. So I think nonverbal communication plays a big role in occupational therapy and rehabilitating patients, and I'm excited to improve my skills and use it more in the future. Thanks.